Welcome to Season 2 of Unprivate Parts. This podcast is a space where women can feel supported and understood as we have open, honest conversations about women's health and the uncomfortable subjects we all want answers to. In this season, we will explore the complex realities of breast and gynecologic cancer journeys, breaking them down with empathy and expertise. From hearing the words, "you have cancer," to making decisions, undergoing treatments, navigating survivorship, and seeking support, we will cover it all. Nothing is off limits, and no topic is too uncomfortable to discuss here. This is Unprivate Parts.
Hi, listeners. I'm Lauren Smith, the Manager of Business Development here at Women's Hospital, and your host of the Unprivate Parts podcast. When someone is diagnosed with cancer, exercise is often the last thing on their mind. Fatigue, treatments, surgeries, and emotional stress can even make small amounts of movement feel overwhelming. In today's episode, we're joined by Alanna Williams, our clinical exercise physiologist at Women's Center for Wellness. She'll talk about the connection between exercise and cancer care, from improving mood and reducing fatigue to maintaining strength and supporting circulation. We'll explore how movement can become a powerful tool throughout the cancer journey. Welcome, Alanna. Can you tell us a little bit more about your role as a clinical exercise physiologist?
As a clinical exercise physiologist at Women's, we have an exercise medicine program that has actually grown with our facility over about 23 years. As a fitness lead, certainly I have some more leadership roles, but one of the main things I am is an instructor for that program. So we see cancer patients and all other types of patients, both coming from a therapy setting as well as fitness members that may have some issues, some health issues, some extra need, and we develop a program that they can be successful at.
Awesome. So my first question is this a referral base? Do you have to have a referral from a doctor, or can anyone sign up?
Anyone can sign up, but our program, we require anybody that comes to see us has to have a clearance from a physician. And that is a point of contact, informing their doctor that they want to start a program. And then certainly as instructors, making sure that if there are some underlying issues or red flags that we need to be aware about, we can plan accordingly for their plan of treatment. Or sometimes we have to refer back to physician, or they might be a better candidate for some type of therapy first before coming to our program.
Now, many people hear the phrase exercise is medicine. What does that actually mean?
For cancer patients, that means exercise and movement is a tool. Just like other treatment options, we give cancer patients to help their bodies heal and recover from the treatment plan. That's not the same for every cancer patient. Every GYN or breast cancer patient is not the same. So the importance here is that we really make their plan, their exercise program unique to them at the stages of where they are, the ages, and also any other underlying health issues that they have in addition to their cancer journey.
When someone is going through chemotherapy, radiation, or hormone therapy, exercise might be the last thing on their mind. Is movement still beneficial during treatment, or do you recommend they come after?
Movement is appropriate at any time, provided that we work with their symptoms in their treatment plan. When we have a patient who sits, can't move, doesn't move, regardless of their health issues, they're going to decondition. They're going to lose mobility, fitness, fatigue, all those negative side effects of not moving. And so finding a way at the fitness level, mobility, energy level that patient is really key.
Many people think exercise has to mean intense workouts, but that's not always realistic during cancer treatment. What types of gentle movement, like walking or stretching, yoga or Pilates, can still provide meaningful benefits?
I think the number one thing is move more, sit less. Now, for some of my breast cancer patients who've been a runner and the last year it's been a journey for recover, I may actually get them on the elliptical, but we're going to work at a heart rate intensity, a perceived exertion intensity. We're going to monitor their fatigue, not just during that workout, but also how they felt later that day, that next day. That's super important. Those types of patients, sometimes I have to pull back a little bit because they want to get back to that running plan. And we know exercise in the right dose is very beneficial. It gives us all those wonderful feelings, movement, strength. But exercise in the wrong dose can certainly bring on the negative side effects, fatigue, soreness, pain. So yes, we can have gentle exercise like yoga, walking, and just simply not sitting down, housework, mobility, getting out in the community. For some of those lower level cancer patients is a good fit. But for some of our higher fit patients coming in prior to their treatment, it can mean more. It can be higher intensity. But again, it's very unique, and we have to adjust it based on how they feel, how their symptoms, and also where their treatment is. How far out from radiation are they? Maybe some of them are actually having some cancer chemo treatment. All right, well, I don't really want to see you until about 48 hours after your chemo. And then we're going to modify based on your symptoms. Your workout might be different than we did a week and a half ago because 3 days previously you had chemo treatment. So it's not a one size fits all for these patients. It's really, really specific to them and where they are in their journey.
Are there certain kinds of activities or exercises that patients should avoid during stages of treatment?
Absolutely. So depending on surgery, if we're a breast cancer patient, if we have some implants, some spacers, we want to limit some chest exercises. We don't want to load that chest wall. So we're very cautious at that. As long as they're cleared by their physician to exercise, we're going to see how it moves. How does that shoulder move? Do they have some tightness from their radiation? We're going to use that movement and see how that feels to that patient. The challenge is guarding, nervousness, being unsure. So a lot of what we do is really work at a light intensity, see where their comfort level is, and then gradually show them what they can do.
After surgeries, such as mastectomy, lumpectomy, hysterectomy, or even lymph node removal, patients often worry about moving too much or doing the wrong thing. What types of movement are typically safe, and when should patients check with their care team first?
So certainly before they exercise, they need to be approved by their physician. So if somebody's had surgery, you're looking at 6 to 8 weeks minimum. Often those patients then are in therapy, so we don't see them for several months after that. But that physician is really key, the type of surgery they've had, whether it's GYN, breast. So we really kind of let the physician guide that. The challenge is that when something hurts, high fit, low fit, cancer, non-fit cancer, nobody wants to move, and that's very scary. So certainly going through therapy, working with a fitness professional can kind of help you work through that. We know that there's certain times or points in time that you should be healed, you should be cleared to do some movement. But again, when it doesn't feel good, that's scary. So starting at a lighter intensity, finding that basic recipe. Okay, I can do these 3 movements. I'm comfortable, I'm okay. And then gradually increasing the intensity or range of motion. So again, it's very specific to that person, but it can be scary. And a lot of patients can do more than they are able to, but it's that partnership between that patient, where they are in that cancer journey, and also the fitness professional.
Just curious, for reconstruction patients, or like you mentioned, the implants, is that a forever thing post-treatment? Are you trying to stay away from the chest exercises going forward, or is that just simply to get you your strength back?
So it's definitely dependent on the patient, and certainly each physician has some guidelines and what they're comfortable with. And I always encourage them to go back and have that conversation with their physician. Typically, something like a plank can be tolerated if they work up to, but actually doing a full-on push-up is not something that we recommend, where we're really heavily loading that chest wall. That's not something we need to do. However, we do have some vertical chest options, and I always encourage them. We're not going to do a heavy weight, heavy load with that movement. Even if we've been cleared with doctor, I'm going to be conservative. Yes, you need to be able to develop those muscles and use them, but we're not going to do high intensity. We might have them focus a little more on upper mid-back exercises like a lat pull down or a row to develop those postural muscles. And then also stretching. Stretching, they tend to be tight through that chest wall, so we encourage some good postural exercises as well as stretching the shoulders and the chest wall. But again, at that light to moderate intensity.
And how can those patients shift the mindset from focusing on intensity, if that's what they're used to, or weight loss, focusing on consistency and overall wellness?
I think often the patients that come to see us have been a patient. They're appointment weary. They've been through a lot. They just want to find themselves. Those that I can see right away when we test them initially, they're high fit. They've been, runners. I know immediately just from experience that I'm going to have to talk to them about too much too soon can, depress that immune system, can slow some of that healing time, increase your fatigue. So it's really a balancing act for those patients. Certainly those that are low fit, maybe have had a longer or more complication with their treatment process. That's hard because everything hurts. They're scared, they're nervous, they're not sure what to do. So a lot of what we do is just motivate them, show them a basic routine that they can start with, build their confidence, and as they can actually see their progress, that they feel better, they want to come very quickly. They're starting to see these positive benefits physically, emotionally. Their sleep is better. They see that we can challenge them a little bit more, and usually they're more comfortable doing so.
What are some practical ways patients can build movement into their daily routine when they're dealing with appointments and this fatigue and the emotional stress?
So often start with what they have access to. So if they've got a beautiful neighborhood, take a walk. If they're not sure about walking independently, recruit a family member. Start with what they have at home. The less that they can sit, the better. That might be plant some flowers. It might be a little yard work, a little housework. It might be calling up a friend to just go meet for coffee, getting out of the house. Sunshine is always important. Even if it's a 10-minute walking up and down your driveway, it's a place to start. Fatigue, it sounds counterintuitive. You're tired. What's the best way to not be tired? Get up and move. I think in the workforce, we all experience that, sitting at the desk, doing all those things, we're tired. If we just take 10 or 15 minutes to get away from that environment that we're at, go outside, get some sunshine and move, your attitude changes very quickly. So it doesn't have to be a membership to a gym. It doesn't have to be super expensive equipment to get started. The main thing is to move and also to find joy. We've got the science that says you need to exercise, but there's really the art of exercise and movement, and finding joy is actually super key. You're not going to do it if you don't like it, if you hate it.
But beyond the physical benefits, how can movement help support, like you were saying, the mental health, your mood? How can that help during treatment?
When we look at an exercise program, whether we have cancer, we don't have cancer, we're young, we're old, we look at what makes people move, what makes people choose exercise over and over again. It's that they feel better. So, and it doesn't take a large volume. It doesn't take super high intensity, just consistency. Twice a week, moderate exercise can make a huge difference. When we see our ladies twice a week for an hour over an 8-week time frame, that's what they tell me. Yes, it's about the testing and the improved leg strength and the arm strength, but they don't feel like a patient anymore. And in an 8-week time frame, they feel like they're moving better. Their normal daily activities are better. They sleep better. They move better. They don't hurt. So those are some really key indicators that the exercise and activity you're doing during your cancer treatment or post-cancer treatment are really where you need to be.
And finding that consistency is so hard. But when you say 8 weeks, that's how long the exercises medicine program is?
We have a couple different options in that program, but primarily our cancer patients, that's that 8-week program that they participate in. And we look at cardiovascular, upper body, lower body strength, balance, bone health. We also have some neutral spine core exercises. So we really try to introduce them to that patient. For some of them, it's a few exercises because they're new exercisers. Maybe they're a little deconditioned. They don't know how to move, and this is a huge learning curve. And others, my high fit, we really ramp that program up, and it encompasses a lot more intensity, more exercises. But predominantly, whether we're lower fit coming in, new exercise, or high fit, we see about a 25% increase in leg strength, about a 25% increase in arm strength, and typically a 50 to 100% increase in their balance during that time frame. So that says doesn't take a lot of crazy new YouTube, Facebook, Instagram crazy exercises, just that consistency and making sure we're hitting all the different aspects of fitness can really build and make a change very quickly.
And what about accountability? I know they sign up and the program is 8 weeks. Do you find the patients are motivated to get there? even starting out low fit, or do you have to kind of be their accountability partner to get them started?
Well, I think the importance of this program is they do meet with an instructor twice a week. They are in a small group setting. So those social benefits there, while they're not all cancer patients in that setting, predominantly they will find a workout buddy that's going through a similar journey. So that social networking is huge. They also are not in a patient space when they come to see us. They're a client, they're like a member. And so to be able to be in that setting and just get a little sense of themselves back is huge just from day one. And so coming consistently. Now, one of the things we do with that program is I haven't heard from a client, I'm going to give them a call. Are you okay? Is it because their cancer treatment? Are they sore? Are they hurting from that program? Do we need to make some changes? And we let them know right away, hey, if you cannot come to class, please contact us, let us know. But we also ask them to come on another day and make up that workout. We offer a membership during that time frame. So that encourages that client to come early before class, stay late, sign up for some of those group exercise classes that come with membership, come additional days. So, hey, if life throws us a curveball and you can't come see me at our Tuesday class, let me know. I'm going to be checking on you. And then plan B, how are you going to make up that workout? Be consistent twice a week. If they can get a third or fourth workout in, that's great. But again, just that consistency is going to get them across the road. I like to say to clients about the turtle and the hare, the children's story back in the day.
Oh, yeah.
For years, I've always said, make like a turtle. Who gets across the line? That doesn't mean it has to be slow and pokey. It's just that consistency and figuring out how to deal with the curveballs, how to get that workout in when you need to pivot.
What does the research tell us about how physical activity can support women during cancer treatment and also recovery?
Great question. One of the things I like to share with clients about their journey, fitness level, is when we look at astronauts when they go to space, they exercise. And that's something that people don't think they do. Well, why would astronauts exercise in space? There's no gravity. So if you're a patient that goes home and sits in a chair, lies in a bed and doesn't move, you're going to have the same effects of those astronauts not being in gravity, not moving. So moving, strengthening, using your body is one of the best things that we can do for your journey, for that recovery process. Whether that's a cancer patient or just being on earth as humans, we have to use our bodies. They're meant to move. They need to move. We heal our bodies through movement.
For someone listening today who feels overwhelmed or unsure where to start, what's the one piece of advice you would give them about moving their body during a cancer journey?
I think the challenge for anybody with exercise, there's so much information out there. It's very overwhelming. And there's, instead of the fear of missing out on all the latest craze of exercise, it doesn't take complicated movements. Sometimes just the very basic, simple movements is a great place to start, and start at what you can do and build from there. Moderate intensity is what we're looking for. Certainly strengthening. We want to make sure that we're strengthening all the major muscle groups, upper, lower body, flexibility, balance, and cardio. So it might be something simple as every day, start walking for 10 minutes. You do that 3 to 4 times a week. Now, next week, add 2 or 3, 4 minutes, 5 minutes to that. Being consistent, adding that routine, and do something. Something is better than nothing. I think if it's too complicated, we're not sure what to do, we have all these barriers to do it. So just sticking with it and being consistent and finding joy in your movement is key.
You are speaking to me today. Finding your joy. I love reframing, thinking exercise as medicine rather than something I have to do. So thank you, Alanna. Thank you for sharing your expertise and helping us better understand how movement can support patients during and after a cancer diagnosis. Movement looks different for everyone, especially during treatment. But finding safe and gentle ways to stay active can be an important part of healing. Thank you for listening, and we hope you'll join us for the next episode of Unprivate Parts.
Thanks for joining us for this episode of Unprivate Parts. Don't forget to subscribe to our podcast so you never miss an episode. For more women's health tips and cancer-related content, follow Women's Hospital on Facebook and Instagram. If something you heard resonated with you, please share it with others. Thank you for listening.